Thank you very much, Mr. Chairman, and the ranking members for holding this hearing today. This is a very important and timely issue, and as was said by the Chairman in the introduction, this has been going on for a long time. It's totally unacceptable. It's a matter of loss of dollars from our Medicare recipients, the providers, and which is why Congresswoman Ileana Ros-Lehtinen and I got together and have put together a bill which has a number of ideas for the committee to consider called the Medicare Fraud Enforcement and Prevention Act. I represent a congressional district in South Florida that, along with others, is on the front line of the battle to fight Medicare fraud. I have constituents who have sent me copies of the Medicare statements, which are absolutely ridiculous. Literally pages and pages of the same services billed over and over again, totaling thousands of dollars that were fraudulently billed and paid. It's deplorable to think that there are people out there that are preying on our seniors, but as everyone knows, it's true. Some estimates say that Medicare fraud totals $60 billion a year, and we all know that's money taken out of the system to line the pockets of criminals and thieves at the expense of our Medicare recipients. So we all know who loses from Medicare fraud. It's seniors who face rising out-of-pocket costs. It's doctors and hospitals who provide medical services. And most of all, taxpayers who are footing the bill at an absolutely staggering cost with every fraudulent claim. In short, we're all losers when a criminal commits Medicare fraud, and we have to find ways to fight back. That's why I teamed up with Congresswoman Ros-Lehtinen, and we've done quite a bit of research, working with law enforcement, the Inspector General, CMS, and others, to get a number of ideas put together which we think can respond to this big problem. We believe that taking a tough, comprehensive approach at attacking criminals who seek nothing more than ripping off Medicare and preying on seniors is the way to address this, by doing it both on the front end and the back end. This two-step approach involves instituting tough punishment and penalties to deter people from getting involved in the first place, and putting in place tough safeguards to prevent fraudulent suppliers and providers from enrolling in Medicare before they get their first check. Specifically, H.R. 5044 doubles the penalties for the two cornerstone provisions used in the criminal code to fight Medicare fraud, the false statements and anti-kickback provisions in the Social Security Act. These penalties have not been updated since 1977. And that time, criminal conspiracies have dramatically advanced their efforts to defraud Medicare. H.R. 5044 will double the criminal penalties to a maximum of 10 years of imprisonment and up to $50,000 in fines. It will also create a new offense for illegally distributing a Medicare or Medicaid beneficiary ID, which is a scam out there where they pull in these numbers, and establishes a maximum penalty of 3 years in prison and a fine of up to that amount for money that was stolen from the government. But tough penalties are not enough. Too often, Medicare fraud enforcement relies on a pay and chase, which Mr. Roscom just mentioned, model, where criminals get paid before law enforcement can catch them. And what happens then is they get the check and they're off and running. So we must take strong actions to stop fraudulent criminals or people in general who are committing fraud from enrolling in Medicare in the first place. And as everyone on this committee knows, once someone gets a Medicare number, it's off to the races. And this is not acceptable. H.R. 5044 would prevent high-risk providers and suppliers from enrolling in Medicare in the first place through tougher pre-screening measures and through the latest technologies use a way of screening these people so they don't get the number in the first place. This way Medicare stays one step ahead of the criminals. Specifically, 4A, the section that I'm referring to in this bill, requires the Secretary of HHS to conduct additional screening of high-risk providers and suppliers with things like background checks, fingerprints, unannounced site visits, and a whole series of other technological tools. Current law only provides the Secretary with the option to conduct these screening requirements. We feel these extra screening steps are absolutely mandatory. H.R. 5044 would also force better data sharing among the agencies and contractors tasked with processing payment claims and the law enforcement agencies who by law must go after these criminals. One of the biggest flaws in the system is the unnecessary period of time in which a potentially fraudulent claim is submitted and when the proper law enforcement agency is alerted. For example, I recently met with the local Medicare administrative contractor in Florida, and while they have some sophisticated computer system to check for anomalies, they only download this information once a week, and by that time, for some people, it's too late. I know this concern for real-time information is shared by many members of this committee, Republicans and Democrats alike, And in lieu of directing an entirely new computer system to perform this work, we believe that requiring real-time access to claims and information would really help law enforcement get a hold of this problem. Current law, again, does not require real-time access, and we believe that it should be, again, mandatory. I'm going to yield now, if I can, Mr. Chairman, to my friend Congresswoman Ross-Lehtinen to elaborate on other aspects of this bill. But I do want to close by saying that we have put this bill together with one goal in mind, and that's to strengthen and protect Medicare for the millions of men and women who depend on this critical program. We don't look at any idea that's being presented here today as Democrat or Republican. We're just interested in what will work and what we can do to keep the criminals and thieves from robbing taxpayers and seniors of one of the best bedrock safety net programs in our country's history. I appreciate the opportunity to testify today. Mr. Chairman, with your permission, I'd like to yield to Congressman.
Happy to yield